Hello viewers, today we would like to discuss certain conditions that run in families, and we call them familial illnesses or diseases. This means that either because of the genes that one carries, they are prone to certain diseases, or somehow we have noticed that these diseases run in families. So it might be hereditary, meaning genetically you stand a chance or you stand a risk, or it is just a phenomenon or something that we have seen running in families. And this will help us understand why sometimes we develop certain diseases even when the other risk factors that are commonly known about these diseases are not there. These include things like high blood pressure. They include things like having a lot of fat in your blood, which as medical people we call dyslipidemia. They include conditions like asthma. They include conditions like diabetes. They include certain cancers like ovarian cancer, breast cancer, but now we've started to see even other cancers like uterine cancer. They include things like sickle cell disease. So these are familial illnesses, and they might occur in the generation directly before you or even past generations. So sometimes you actually don't know about a disease running in the family because it has skipped a number of generations or it has skipped one generation. So when you develop these diseases and we tell you that this is a familial illness, do understand that that possibility is there even if you haven't heard of it. And this goes back to why we keep speaking about a healthy lifestyle. Maintaining a healthy lifestyle is important whether or not you think you are at risk. And you have to do the common things that we have been talking about: getting enough exercise, getting enough sleep, drinking enough, avoiding substances like alcohol and drugs and smoking as well, that would put you at risk of developing these familial illnesses. Making sure that you do go for medical checks, not because you're not feeling well, but even when you feel well, to do these medical checks so that if these diseases come up, they're actually picked early and intervention can be done early. So some of the familial illnesses like sickle cell disease, one needs to know that this is a genetic or inherited disease. That means you get genes from your mother and from your father, and if you get two sickled genes, it means the child will have sickle cell disease. Others don't necessarily require inheritance of genes from both parents. The other conditions that I mentioned, actually you just need to have one first-degree relative, meaning an immediate relative who is either mother, father, sister, auntie or uncle, who has had them, and that means that you're at risk of developing them. So if you have somebody in your family, you know they've had high blood pressure, they have had diabetes, they have had asthma, they have had some of these cancers that we hear about, you need to be cautious. It is important for women to know certain practices like self-breast exam, because breast cancer is known to be a familial illness. So knowing how to examine your breast so that if there is a small lump that has come, you can actually have this checked. So familial illnesses are with us. Sometimes we don't acknowledge them, but now we need to know that they exist, and we should be cautious and keep going for medical checks to ensure that if they do come up, like I said, they are picked early and they are managed early, or they are prevented from advancing to stages where we cannot actually treat them. Things like diabetes, these are things that can be prevented by ensuring that you're doing the check, so that when you're in the pre-diabetic state, we can actually advise you on how not to get to the diabetic state. If you're pre-hypertensive, we can advise you on how to ensure that you do not get to the hypertensive stage. If you have a precancerous lesion, we can advise you on how to see that the cancer doesn't upstage or upgrade, and maybe we can remove that lesion or that mass that has grown, so that we get rid of the cancer. So that is just to shed more light on what familial illnesses are and some of the common examples that we know, so that you can start to think about them and seek advice where necessary. Thank you.